Hi, I'm Roman Lysecky, CTO and co-founder for BG Networks. I wanted to thank everybody who joined our recent webinar on medical device cybersecurity. We had close to 50 attendees interested in gaining practical knowledge about FDA's 510(k) submission requirements. The webinar was packed with insights and FDA-ready solutions, and it brought up some great questions from our attendees. They were smart, they were insightful, and they were exactly the type of questions we need to be thinking about to make sure we're securing medical devices. Here are a few of the standout questions that really sparked deeper thinking and deeper conversation. The first is there such a thing as an acceptable level of risk? So, as part of a secure product development framework, just as you have in a quality management system for safety, you have the concept of controlled risks and uncontrolled risks. In doing a threat and risk assessment for anything that's considered an uncontrolled risk, you need to put in the mitigation and cybersecurity requirements to ensure you've reduced that risk to a controlled level. What's interesting is also that the connection between the quality management system and a secure product development framework for cybersecurity is the definition of the impact to patient harm, your safety evaluation. That same evaluation should be common between your cybersecurity risk assessment and your safety risk assessment. Another really good question that really hit home was, how do we measure if a threat model is truly accurate? Threat modeling is not a checkbox. And so what it really requires to make sure your threat model is adequate is a process, a systematic process that allows you to make sure you're comprehensive, you're thorough, and you're covering all the relevant threats you need to consider to make sure you can adequately secure your device. Using a threat model such as Stride as an example gives you the ability to think through systematically 6 different types of threats against every asset you may identify within your system. That helps make sure you're being comprehensive, sticking to that process. What's also important is that your threat model can be adequate at the time you created it, but you need to revisit it over time, continually update that to make sure it stays adequate. So if you discover a new threat or new vulnerabilities in your system, even post-market, you're adding that to your threat model. You're redoing your risk assessment to make sure your devices stay secure, not just at the time of submission, but throughout the product lifecycle. The last question that I wanted to highlight is one that's somewhat of a classic debate, which was, who should own the SBOM creation, the dev team or the security team? In this one, I would say it depends. Ultimately, it's a shared responsibility. The dev team and the cybersecurity team need to be working hand in hand to make sure you're identifying, creating your SBOM, you're identifying vulnerabilities, you're patching your system, updating software to make sure you're mitigating any vulnerabilities discovered. So who should create it really depends upon your organization and the type of software that is being integrated within your system. If that's better suited for a dev team to implement as part of the build process in a CI/CD environment, then they would be best suited to take on that responsibility. If your cybersecurity team has a set of tools that allows them to scan pre-compiled binaries and create an SBOM and make sure they're comprehensive in nature, and they're best suited to do that, they should take that ownership. So ultimately, it's those two teams who need to work together to make sure you're creating SBOM and then using it appropriately as part of your overall security processes. I wanted to thank everybody again who joined us. Thank you for asking the insightful questions, the big questions, helping to shape the conversation that we had. If you missed the webinar or you want to go deeper, drop a comment on the video and I'll be happy to share it with you.